Hello and welcome to the Beyond 6 Seconds podcast. I'm your host, Carolyn Keel, and on today's episode, I'm very excited to be speaking with Chien-Chi Huang. Chien-Chi is the founder of the Asian Breast Cancer Project and the executive director of Asian Women for Health. Her personal cancer journey led her to participate in national as well as local efforts on health equity and racial justice. Her remarkable passion for the community has changed the healthcare landscape for Asian women and created a pipeline of future leaders and peer health educators. Chien-Chi, welcome to the podcast.
Thank you, Carol, for having me.
I'm so excited to have you here and really interested in learning more about your own personal story and what inspired you to create these initiatives. So how did your personal experience with cancer inspire and lead you to start the Asian Breast Cancer Project?
Sure. So I'm an immigrant from Taiwan. And when I first came to this country as an international student, I can barely carry a conversation in English.
Mm-hmm.
And so when I was 40 years old, I was diagnosed with breast cancer. And even though my husband is American, was not Asian, I still have a difficult time navigating the U.S. healthcare system. And I also realized that a lot of the Asian women having difficulties, getting the support and information they need. So because of my personal experience, I feel like, when I was doing the treatment, I always longing for other Asian women who look like me, feel like me, think like me, to share the experience, but I couldn't find any. So after my diagnosis and after my treatment, I recognize that there's a need for this because there's no program or services catering to Asian women. So I decided to share my story. I went to a Chinese newspaper and I share about my story, and I said that I would like to meet with other Asian cancer survivors, and so we can start some kind of speakers bureau. And then several Asian women saw the newspaper article and then reached out to me, and then that was the beginning of the Asian Breast Cancer Project.
Oh, wow. Yeah. And, you mentioned really having this need and desire to have a community of Asian women who sort of basically knew what the experience was that you're going through and kind of have that community while you were going through this challenging time. I understand from listening to reading some of your work and listening to some of your other interviews that there are like some relatively, I would say, unique or specific health-related challenges within the Asian community itself, around, say, stigma and other things.
Mm-hmm.
I'm wondering, could you shed a little light on some of those things that you encountered while you were going through this?
Sure. So as I mentioned, I think that, because cultural and linguistic barrier, I personally and professionally witnessed Asian women being diagnosed, mistreated, and misinformed. So right now we're actually having a new initiative. We're working with different ESL providers to create health curriculum so we can improve the health literacies among immigrants and refugees, and also to connect them with the local resources. And we find that this is a really good way to destigmatize, the situation, so they don't feel like they're stigmatized to wanted to learn about different diseases. And so most people don't know that lung cancer is the leading cause of death for both Asian men and women. And in fact, I think 40% of the people who diagnosed with the non-small cancer, lung cancer, is of Asian descent and who are non-smoker. And breast cancer is the most commonly diagnosed breast cancer among all Asian American women. Um, yeah, and then there's hepatitis B, which is also disproportionately impacting Asian Americans and could lead to liver cancer. So this is something that's unique for the Asian population, because all the other population, the number one killer is heart disease.
Right.
Mm-hmm.
Wow. Yeah. And those are some really sobering findings. And, I imagine some of the challenges, obviously around language and stigma. It might even be just getting people to go to the doctor when they're having symptoms in the first place and get that sort of checked out as well.
Right. Yeah. And that's why education and outreach and awareness is so important, because we know that in Massachusetts, Asian American actually has the highest insurance coverage rate, but we have the lowest preventive care utilization rate. Yeah.
Yeah. So yeah, that's a lot of education. I know that's a lot of
Mm-hmm.
what you do with the project as well.
Yeah.
So,
Mm-hmm.
and, since then you've also expanded, beyond breast cancer and focusing on that to focus
Right.
more broadly around physical and mental health
Right.
uh, issues, challenges as well. Because, I understand from your story that while you were going through the treatments, you experienced a lot of, sort of distressing and confusing physical and mental symptoms from some of the treatments that you were on. And I imagine that must have been challenging, not really even being aware of what these side effects could be from the types of
Right.
treatments you were getting.
Yes. And I'm a believer of the mind-body connection. And I talked to many of the cancer survivors, cancer patients, and I realized that most people before their diagnosis, they all experience some kind of major setback in their life. And so and also during my cancer treatment, I was prescribed to prednisone, which is a very strong steroid. And I actually experienced a very rare side effect where I, develop, I become paranoid, and also I have a psychotic manic episode. And I thought that my in-laws and my husband are trying to, kill me and cut me off from the outside world. So it's really something that you wouldn't realize unless you personally live the experience.
Mm-hmm.
Yeah. So mental health is something that's very close to my heart, and it's something that we don't talk about, but there's really a need because when physically, if we got hurt, we will seek the help of the professional. But then when we have mental health needs, most of the Asian Americans will not seek professional help. So it's important for us to see people to speak up and also to share their stories, so we won't feel so afraid and alone. Yeah.
Yeah, absolutely. And just as you said, that sense of community and just sharing of information and experiences is so important during a challenging time like that. Absolutely. So the Asian Breast Cancer Project was kind of the start. That was what was founded initially, and then you went on shortly after to start your nonprofit, Asian Women for Health, which focuses more broadly on physical and mental health for Asian women. So how did you get the inspiration to actually start a nonprofit to focus on this?
Right. So as I mentioned, I went to talk to the media, and then afterwards, I thought that I need some training, so I went to talk to the Massachusetts Komen Foundation, and I said that, do you have a program that you train survivors like me to do outreach education? And they say, no, why don't you start one? So I
Wow.
was invited to create a program. So I did some research and I found a program that's catering for the African American community. It's called the Witness Project. and I adapted that for the Asian community. So that's the genesis of Asian Women for Health. Yeah, and as you mentioned, we expanded, and we don't want to be a disease-specific program. We wanted to actively promote health, and also with a holistic approach that's including emotional well-being. So we've been doing annual conferences, and we have a program called Achieving Whole Health, where we teach participants how to set and maintain personal health goal. And we pair them up with a health buddy so they can support each other during the 8 weeks.
Wow. So it is sort of a peer-to-peer support
Mm-hmm.
mainly for,
Yeah.
okay. So like
Exactly.
pairing survivors or people who are going through similar
Yes,
circumstances with others.
Asian women. Yeah. Mm-hmm.
Wow. No,
Right.
that's really great. So
Mm-hmm.
how, how have, since you've started it, how has Asian Women for Health grown in the past few years?
So I would say that we are doing more and more advocacy work. I'm sure you know that, because I see that you're in New York. Since the pandemic, the anti-Asian incidence has surged tremendously. There almost, there are over 3,800 incidents against Asian Americans, and especially towards Asian women, Asian women are 3 times more likely to be attacked than Asian men. So before the pandemic, there's already a higher rate of anxiety, depression among Asian women. And after the pandemic, because of the isolation and also the anti-Asian incidents, a lot of the Asian women are afraid to go out in the public. And so we've been trying to provide monthly events, virtual events, as a way to help people to break the isolation and also to disseminate health information. Like I said, we realized that we're doing more and more advocacy work. And I personally actually encountered a verbal attack on the subway in Boston. Yeah, so because of that experience, I reached out to an animation studio, and they helped me create a PSA called "Racism is a Virus." So we put that on our website, and we also curated some anti-racism resources, and we want people to screen the PSA, and we also develop a downloadable discussion guide so people can use it to help do digital town hall or hold private watch party, so they can talk about how racism impact all of us and how we can show up for each other.
That's really great. I mean, that you provide that level of support, because, yeah, I mean, the incidence of racism and violence targeting the Asian community, and especially Asian women, has been like really disturbing, and definitely something that's certainly been on my mind as we read the news and see all the incidents going on. Yeah, and I'm just thinking I think it's great that you have these resources to help people. And I imagine that the whole sense of community that Asian Women for Health is meant to build, it also, I would hope, in some ways, kinds of at least helps bring people together and let them know that, they're not alone, and they don't have to be by themselves with it when they're experiencing this horrible racism and violence. It's good as well. I was kind of curious about the connection between mental health and just sort of living in this heightened time of racism and violence in the Asian community here in the U.S. If it really is, because I'd imagine that a lot of people, at least certainly a lot of people that I've known from the Asian community, sometimes there's like kind of almost like a shame or something. Like, it's not normally something that you talk about. So I would imagine that's a big change for people to come out and say, like, no, I experienced this racism or this violent act, and I want to tell people that this is what happened, or I want to talk within my own community to kind of process it and see that. So is that something that Asian Women for Health helps with as well?
Yeah, so we're hoping to disseminate information through social media, and we're trying to have like storytelling training, so we can teach Asian women how to speak up and how to be more visible and vocal during this time. Yeah, so those are the kind of things that we're planning to do. Yeah.
Oh, that's really great. Yeah, I think, the sense of community and support is even more important now than perhaps even, before the pandemic or a couple of years ago. That's
Mhm.
really wonderful. Wow. So, I mean, long term, what are your goals for Asian women for health? Are there things that you want to expand into that you're not currently that you haven't gotten a chance to do yet, or other things that you want to start doing?
Well, thank you for the question. I actually been thinking about that a lot lately. So, so we have been doing a lot more research and focus group, because I think that nowadays a lot of the public health agencies or health centers, they also wanted to find way to reach out to the Asian community in a more culturally responsive way. So we actually, yeah, next week we're doing a focus group on hepatitis B and liver cancer, and then we also have planned to do focus group uh, on dementia as well as diabetes, and these are all diseases that are impacting Asian Americans, but there's not that much data is available.
Mm.
So we've been, taking upon a more active role in working with other agencies to collect data and to get information. And the other thing that I was thinking about to do, which is more on the personal level, is that I wanted to create a community to support Asian women entrepreneurs who have products or services that nourish our mind, body, and souls. So I think that we all wanted to create product or services that's for ourselves, but then we don't see it on the market. So
Yeah.
that's something that I think it's needed. And yeah, so I'm really excited about that. Yeah.
That's great. Wow, that's such a an amazing expansion. And I want to ask you, but before you started the Asian Breast Cancer Project, what was your background? Like, what type of work were you doing before that?
Oh, so when I was in Taiwan, I worked for advertising agency.
Oh.
Yeah, but then I stopped the agency work because I feel like the work is kind of superficial and very stressful and low pay. So it looked very glorious, like working for the advertising,
Mhm.
but it's not really that great. And then when I came to United States, I got my master degree from BU and I kind of make a shift to do video production.
Oh.
And yeah, so my last project I was doing, I was the associate producer for for WGBH. We did a documentary about Taiwan. It's
Mhm.
called Talk of War. And then after that, um, I was pregnant with my second child, and my husband, changed career, and we moved to Washington D.C. So I stay home for 7 years as a stay-at-home mom. Yeah.
Wow.
So that was my background in
Oh
video.
my goodness. Yeah, and that's just so intriguing to me because I do have a lot of people on the show who will talk about making career changes and kind of how they did it, and just you can really have backgrounds in we all have multiple careers throughout our lives these days, so you can have just different experiences and backgrounds in different industries and really just pivot. And it sounds like that's something that you were able to do relatively successfully throughout your life, is sort of make those career shifts. And yeah, that's really cool.
Yeah, thank you. Yeah. Mhm.
And it kind of sounds like there's, I mean, thinking of advertising and then the other types of work, I kind of see like a theme of storytelling in a way, sort of
Yeah, yeah,
sharing. It's
yeah.
like that makes the tie.
Yeah, yeah. I'm still you know, I always look for ways to channel my creativity to through my work.
Yeah.
So yeah, so the PSA, the Racism is a Virus PSA, I got to, conceptualize the whole video. So that was a fun project to do. Yeah.
Yeah, well, that's great.
Hmm.
I think that's something that we need more of as we try to build these connections with each other, is just how do we effectively tell our stories and share our own stories, whether it's
Hmm.
getting the courage to do it in the first place, and then how do we communicate that with people. So no, I think that's really, really wonderful. Wow. So, I mean, things are really, quite challenging now. We're still in the middle of the pandemic, regardless of what people may or may not think. But it's been a challenging, several months for almost everybody, and certainly for um, communities like the Asian American community that have been just experiencing the increased racism and violence. So I don't know, are there things that you would recommend for people, whether it's Asian women or really anyone, I guess, who are kind of feeling like they're starting to struggle with their mental health now? Sort of any advice or any guidance that you might give them for that?
Hmm. Sure. So I think that I would just, emphasize again the mind-body connection. So, definitely, at our Achieving Whole Health program, we teach people to, do the mind shift, like, because we tend to come in with a negative mindset. So we ask people to do the 3 C's, which is to catch and to check and to change. So whenever you do to catch yourself when you have the negative thinking, then you wanted to check it against the reality. Then you can make the change, reframe it, and to change it in a more positive way.
Mhm.
So that's how we, and also to practice self-care. As Asian women, we tend to put everybody's needs before our own, but we also, trying to get people to recognize that if you're not well, you cannot take care of other people. So to take care of self is essential. It's how you can sustain yourself, and so you can take care of other people.
Yeah. Yeah. And self-care is absolutely important, especially, in times where there are a lot of people who feel have additional responsibilities and to take care of their family or friends or their wider community, to think of that. And yeah. And then the 3 C's, sounds like a really great way to just, kind of try to live and experience and be here in the present, as opposed to, the past or the future. Just be mindful of that. Well, that's great. That's really great tips. Yeah, thank you for sharing those.
Mhm.
And you're based in the Boston area, is that correct?
Yes,
So
yes.
Asian Women for Health, I think it's largely now, is it mainly focused in Boston or Massachusetts, or are there resources that it has for outside of Boston area?
Yes. So before the pandemic, we do in-person outreach education, and it's mostly in the greater Boston area. But since the pandemic, we were able to pivot and to provide our programming through technology. So we have an annual conference called Asian American Mental Health Forum. Last year when we were able to do the conference virtually, and we have over 230 participants, and people from even Canada or Germany
Wow.
come to join us. So this year the conference is going to take place on June 5th, Saturday, June 5th. And I can send you the link, and then people can register. It's free and open to all.
Oh, that's wonderful. Yeah, I'll make sure that that's in the show notes so that
Mhm.
people can just click on it and register from there. That's great.
Sure.
Thank you.
Hmm. Yeah.
Wow. So, what is the best way for people to get in touch with you or, get in touch with Asian Women for Health if they want to learn more about it?
Yeah, they can just email info@asianwomenforhealth.org. Yeah, and our website is www.asianwomenforhealth.org.
Okay, perfect. Yep. I'll put that in the show notes as well. So,
Thank you.
yeah, that's wonderful. Yeah, Chien-Chi, thank you so much for spending time with us to share your own story and talk about all the amazing work that you're doing. As we close out, is there anything else that you'd like our listeners to know or anything that they can help or support you with?
Yeah, so I want people to know that Asian American community is not monolithic. We're a very diverse community. We are 23 million people strong, accounting for 7% in the entire US population. And we are not all healthy, wealthy, and well-educated. We're not the model minority. And we welcome people to volunteer with us. Even remotely, you can volunteer. You don't have to be Asian or woman to volunteer with us.
Wonderful. No, that's great. Yeah. Well, I'm so excited to share these resources with my audience. So, yeah, thank you again, Chien-Chi, for spending time with us today. Really appreciate it.
Thank you. Thank you, Carolyn.